When sending orders for prescriptions electronically, what legal requirement must be met? So option A states the prescription must be signed electronically by the provider, and that is absolutely correct. The provider always needs to sign their prescriptions, and in this case it's electronically because this prescription is also electronic, and the provider needs to sign it because that's their attestation for the prescription, that they wrote it, that everything they wrote is correct, and that is an obligation that they have to have. So that is the correct choice. But let's take a look at the other choices. Option B states that prescription must include the patient's full medical history, and that is not correct because we would not want to give out more information than that's necessary about any of our patients, and it's not necessary for the pharmacy to have a full medical history for a prescription. It's understood that when the provider writes their prescription that they have into account all the patient's medical history and they understand what it would be deemed appropriate for this patient. So we could eliminate option B. Option C states the prescription must be sent to the nearest pharmacy, and that's not correct either. The prescription should be sent to the pharmacy of the patient's choice. It might be the nearest, but maybe they prefer it going somewhere else, and in some cases it might even have to go to a specialty pharmacy, which might not also be the nearest pharmacy either. So therefore option C is incorrect. And then option D states the prescription must be printed and given to the patient. And no, that is not correct. It says it's an electronic prescription, and therefore it's sent electronically to the pharmacy. It's not printed out and given to the patient. So that's also incorrect. And that leaves us with our choice, option A, which we had chosen. The prescription must be signed electronically by the provider.